Good evening to all the viewers who are watching live and will be watching on the recorded version. This is me, Orko Mukherjee. For now, it's Dr. Orko Mukherjee, and the IT manager with you. And before starting the CME, I just want to say a few things that we are facing some issues with that uh, e-participation certificate thing. We are trying to get that soon because due to some drive errors and means Google Drive errors, we are facing that problem for which you are fill up in the form, but the certificate hasn't been transferred to you guys. So we are seeing on that. Just give us some time. So with this, we have wasted just 6 minutes, and without wasting any more time, let's just jump into our 30 seconds countdown time.
Good evening, everybody. Good evening, sir.
Good evening to all of you.
And tonight we are blessed with 113th online CME live, organized by National Institute of Homeopathy Alumni Association. With me, we have our beloved, respected Dr. Devnaran Kalyani, sir, our president. And with your permission, sir, uh, let us call tonight's inaugurator, sir.
Please call her.
Thank you, sir. We'll be calling our tonight's inaugurator, Dr. Geeta Sharma. She had been a very dynamic student and now a practitioner. She is from Nepal, but now practicing at Muzaffarpur as well as in Nepal. I'll request our IT manager to bring Dr. Geeta Sharma on screen, please. And we'll be blessed with welcome, Dr. Geeta, and we'll be blessed with the speech of our beloved Director IC of National Institute of Homeopathy. Once he is there, Dr. Geeta will be requesting him to be on screen. Over to you. The stage is all yours, Dr. Geeta.
Namaskar to Dr. Kalyani sir. Namaskar Dr. Bidyut Mukherjee sir. And good evening to all of us who is watching this program, CME program. It's a great privilege for me to be the part of this CME session. It's my second time in this CME. Before I was as a speaker in third session also. Thank you, Dr. Bidyut Mukherjee, sir, for giving this opportunity to inaugurate this 113th session of the CME program. And I want to thank to the NIH Alumni Association for conducting such a good CME, which is very helpful for all of us to practice in day-to-day life. We need this type of CME from time to time. And I also want to congratulate our new director in charge of NIH, and the most dynamic person, Dr. Pralay sir, and the most favorite teacher among the students, who is always helpful to the student as well as to the teachers also. And he is from the first batch of NIH, and he is also an NIH alumni. So it's a great privilege for us. I welcome Dr. Pralay sir.
Thank you, thank you. Thank you, doctor. Thank you, thank you, thank you, thank you. Thank you, Dr. Geeta, for your kind words. It was excellent introduction for me. And as you all know that it is an absolute honor for me to address once again as a director in charge in this special CME webinar organized by uh, National Institute of Homeopathy Alumni Association. This moment holds a great significance as it brings together our esteemed alumni, uh, ex-students and professionals dedicated to the advancement of the homeopathy, growth and homeopathy. Our Alumni Association has always played a significant role in fostering knowledge exchange and professional growth. Today, CME is another testament to our collective commitment to the continuous learning and improvement in homeopathy practices. I would like to congratulate Dr. Geeta, Dr. Ravindra, and today's inaugurator, Dr. Chintamani. I'm missing him out here. Um, I believe that this program will go well because we are dealing today with the such a interesting topic that is a psoriasis. As you all know, the psoriasis is an autoimmune disease, and uh, in their lifetime, who has a psoriasis has to come and take a treatment of homeopathy. That is of sure. During this course of treatment, we try to give them the constitutional treatment. We do have certain specific remedy too for the treatment of psoriasis. But in this platform, what I like to share with you that whenever we deal with a case of psoriasis, always tell the patient that if you improve with the homeopathy medicine, do not be happy. If you have a worsening of symptom, do not get disappointed. It is a treatment procedure in homeopathy. It will take a longer time to improve, and whenever it will improve forever. And that is the fundamentals of homeopathy. It is. And while treating this psoriasis cases, I believe that we can arrest the complication of psoriasis, like psoriasis orthopathy. I believe that today's this program will go well, as it is a Sunday and I do have a certain commitment too. I'll be listening online uh, this whole of the program. I wish Dr. Ravindra will give a good justice into it while discussing this topic on the psoriasis and its homeopathic treatment. Namaskar, Dr. Kalyani sir. Uh, Pranam. And namaskar to our secretary, Dr. Bidyut Mukherjee. And namaskar to all the students and the viewer who are watching online this time and will be watching in future in YouTube. I would like to I would like to be very thankful to them for watching this webinar today. Thank you so much. Thank you very much. Thank you, everyone. Dr. Geeta, here is your floor.
Thank you, sir. Thank you, sir. Thank you, Dr. Pralay, sir. I think Dr. Chintamani Nayak, sir, is not here. He is having some network issue. So without delay, I'm introducing Dr. Ravindra Roy, who is the speaker of today's session. He is the president of Nepal Homeopathic Chikitsak Sangh. He will deliver a topic on psoriasis and its homeopathic approach. As we all know, psoriasis is the most challenging case. And the most challenging case because for in modern medicine, cure is not possible. And in homeopathic, we have to give patience. Even the doctor side and the patient side both have to um, do a hard work on this psoriasis. So our speaker will tell us and give his experience. Some WhatsApp. call is coming, so sorry for that. He will be sharing his experience and deliver the speech, the topic on this psoriasis and its homeopathic approach. So I welcome Dr. Ravindra Roy, the president of Nepal Homeopathic Chikitsak Sangh. He is my senior from 13 batch. Welcome, Dr. Ravindra Roy.
Thank you, Dr. Geeta. Really, thanks. She is my elder sister, and I love. Uh, First of all, I would like to thanks Dr. Kalyani sir, Dr. Bidyut Mukherjee sir, Dr. Geeta, and I congratulate Dr. Pralay Sharma sir, my- our beloved teachers, big brother, our guide, and almost lovers of NIH. Dr. Arko Mukherjee, he is one of the backbone of this CME. Today, I am really, I feel very much uh, that Dr. Arko Mukherjee continuously give his effort to conduct this CMA from very beginning, and his continuous effort is going with us to promote homeopathy. And really, I appreciate the effort of Dr. Arko Mukherjee. Thank you, Dr. Arko Mukherjee. Today, my topic is psoriasis and its homeopathic approach. This is a really Dr. Pralay Sharma sir recently says that the psoriasis is a very challenging case, and the patient as well as the doctor have the patience for the treatment of psoriasis, because we all know that the psoriasis is a very relapsing disease. We think that it is cured, but after 2 or 3 months it again reappear. So we have to consciously share to the patient that it may be relapsing. So don't be afraid or panic from this. We will treat you and we will recover you from our best side. So first of all, uh, I'm going to my Dr. Arko, please. I'm not visible my slides. Please assist me. Okay. Thank you. Psoriasis is an chronic, immune-mediated inflammatory skin disorder characterized by hyperproliferation of keratinocytes and immune system deregulations. It is a multi-systemic condition with systemic manifestations including psoriatic arthritis, cardiovascular disease, and metabolic syndrome. Epidemiology: it affects 2 or 3% of the global populations. Onset can occur at any age, with peak in our 20s and the 50s. In between this 20 and 50s, it will occur in most of the populations. No gender predilections. More prevalent in Europe than in Africa or Asian populations. Chronic relapsings and remitting course. Significant impact on quality of life due to physical, psychological, and the social burden. Once the skin manifestation is there, and really it's a very psychological effect and a sociology, social burden. Really, it is a very difficult to go anywhere to shake hand with the people, with our friends. It's a very difficult situations. And what is the pathophysiology of the psoriasis? Basically, it is an immune mediated disorder in which the inflammatory T cells activates leads to the overproductions of the cytokinins, causing keratinocytes hyperproliferations. Second one is the hyperproliferations of the keratinocytes, resulting in thick and scaly plaques. We all know that in a psoriasis there is the very thick and the scaly plaques are present, and that is the very big difficult situations for the patients. And along with this, that the inflammation is also present in a psoriasis case. For this is the involvement of IL-17, IL-23, and the TNF alpha pathways. What are the type of psoriasis? There are three or four types of the psoriasis. First one is the psoriasis vulgaris. That is very common. 80 and 90% of the populations may have suffered from this psoriasis vulgaris. Second is the gutta psoriasis, small drop-shaped lesions, often triggered by the infections, any kind of infection. Inverse psoriasis occurs in skin folds like axilla, groins, under the breast. These are the very common sites where the psoriasis is developed. And the pustular psoriasis, it is a very uncommon, but it is present. And the pustular psoriasis is the white pustule surrounding by the inflamed skin. Where there is the psoriasis is developed, that the minute small eruptions are surrounded in a round shape, and that eruptions are joined together and develop a pus where there, and at that area in between this surrounding area there is a very inflamed skin, and from that is inflamed part the plaques are developed. That is the pustular psoriasis. And the erythrometic psoriasis, that is rare but severe, widespread erythema and the scaling. Causes. What are the causes of the psoriasis? We all know that the immune deregulations, that is the immunosuppressive disease. So immune regulation is the most active cause for this. So that in allopathic, really generally in case of psoriasis, generally all the allopathic doctors, most of the doctors are used steroid medicines. So at that very long term for the steroid medicines, it will get a very side effect for the long term of the steroid. So it is not preferably for the patients as we know, but patients get some fast relief. So generally. Uh, Generally, patients uh, take some steroid medicines or a ointment for his uh, uh, recovery, for the fast recovery. And in the immune regulations, that the T cell activations and the overproduction of pro-inflammatory cytokine. These are the responsible factor. Other factor is the genetic factor. Genetic factor is the family history increases risk. Where there is the family history of the psoriasis, most of the common patients we see that the her children or grandsons or the granddaughter may develop psoriasis. Strong genetic predispositions. Third one is the polygenic interference with the environmental trigger. Sometimes environmental trigger may also insist or increases the psoriatic conditions. What are the causes? Environmental trigger like infection. Like streptococcal pharyngitis is the most common infections. After that, this trigger or psoriasis trigger in a very extreme level. Second one is the stress and the trauma. This is the nowadays it's a very common, and the stress and trauma is a very common for in our society. So it is one of the most common cause and very important cause for the aspect of the homeopathy. So we very considered that the stress and the trauma we consider it a very characteristic symptoms as a causations when we are taking any totalities like staff specific area medicines where there is the stress is the most common cause for the development of psoriasis. Other one is the medications. Like if anyone have the heart problem, then most of the common medicines used by the beta blockers uh, and the other group of medicines, the NSAIDs. These medicines, if we take for a very long time, then it may develop from the side effect of these medicines may develop the psoriasis conditions in a patients. Apart from that, smoking and the alcohol consumption is one of the accessories causes of the psoriasis or may exacerbate the psoriasis conditions from it. And other is the climate. It's a very common cause or a very common trigger factor. We see in a clinic that when the most of the patients say that doctor, when the winter is coming, my psoriasis is really very aggravated. That is the climatic situations from which the patient is suffering and increases his psoriatic conditions. So that the cold and dry weather exhibits the psoriatic symptom. What are the clinical features of the psoriasis? First symptom is the cutaneous manifestations, which is the very prominent and we get day to day in your practice. What are the clinical cutaneous manifestations, that the skin manifestation? That is the well demarcated erythematous plaque with the silvery scale. Really, it's a white, or sometimes is a brown. Sometimes it's a large flake, sometimes it's a very dusty flake, sometimes a thin, sometimes a thick. But as per our practice of medicines, the symptoms are written here that the silvery skin, and we have each and every skills. For the different type of skills, we have the different type of medicines. So we have to consider whether it's a thick or a thin, or it's a dusty, or it's a cracked. Each and every skin manifestation we have to consider for the totality. Second one is the commonly affects extensor surface, extensor like a elbow or a neck, and the scalp or a lower back. These are the common sites where the mostly psoriasis develops. And nail art changes like pitting, onychomycosis, oil spots, sublingual hyperkeratosis. Second one is the systemic manifestation, like the psoriatic arthritis. 30% of the patients having the psoriatic arthritis, increased risk of cardiovascular disease, metabolic syndrome, and depression. How we will diagnose the psoriasis? That is from the clinical examination based on the characteristic lesions. That is the demographic findings, regular dotted vessels, and the white scales are present in the psoriasis. Histopathologically, hyperkeratosis, acanthosis, Munners microabscess. And from the blood test, we generally increase inflammatory markers like the CRP and the ESR because there is the inflammations underneath the scales of the psoriasis. So generally the CRP is high and the ESR is high. Presence of HLA, and that is the genetic marker. How we will differentiate from the psoriasis and the other like other eruptions like eczema? That is a very confusing whether is the psoriasis or eczema. But in case of psoriasis, there is always a uh, scaling. But in eczema, it is a very rare. Otherwise, the seborrheic dermatitis. In these conditions, generally we saw that the very uh, dust parts of the skins are falling. Generally, it is developed on near the scalp or the margins of the hair, like that the lichen planus and the fungal infections. What are the complications of the psoriasis? Psoriatic arthritis is the progressive joint damage. So once it is the if the very long term for a long time psoriasis is not treated or may be treated with the help of steroid, then after that generally we see that the psoriatic arthritis is developed. It is a very painful, and it is a really a progressive joint damage in which joint the strength of the joint is diminished. Patients cannot stand itself or cannot hold anything. It is a very difficult to walk, too difficult to bend, too difficult to sit due to the psoriatic arthritis. And it is developed on the knee so that while sitting the skin of the knees is cracked are very painful, so patient doesn't want to sit or folding the joints. Second one is the cardiovascular disease. It is an increased risk of MI, medical infection, and the stroke. Second is the psychological impact. Really, it is a very psychological impact is most of the common factor in case of psoriasis. Like patients may feel the depression, anxiety, or low self-attention. Like that, metabolic syndrome also develop from this, like obesity, insulin resistant, and these are the complications of the psoriasis. Lifestyle modifications. How we reduce psoriasis? Like from the weight management, we can reduce the psoriasis. We can cessation of smoking, we can reduce the psoriasis and the stress reductions by the help of yoga or uh, anything which you feel pleasures or feel stress buster. You can do this for psoriasis overcome. Food modification. It is a very important thing for psoriasis conditions. Even that any of the skin conditions like what are the food to avoid in a psoriasis? Generally, we prescribe the medicines and we are not tell the patients to about the restrictions or restrictions of the diet or what he will take or he will not take. We have to suggest if with the skin disease, it really very helpful. Always I see in my practice. So it is very helpful. What are the foods limited or the avoid in case of psoriasis? First one is the saturated and the trans fat. That is the found in the red meat. Red meat are really in some conditions, not in all. In some conditions, red meat or fish may increases the psoriasis conditions. Second one is the dairy product and fried food, migraine, and the many processed snacks like that the processed food including the processed meat, packaged snacks, and the food high in added sugar, salt, and the fat. These are the food which may avoid or limited for the psoriasis patients. Along with this, the refined sugar and the high glycemic foods such as sugar, drink, candy, pastries, white bread and the white rice. These are the some food which may aggravate the psoriasis conditions, but it is not no need that we avoid all these things. First of all, we have to individualize by asking the patients that what type of food you take in your regular diet, and in which food you will get the aggravations of the disease. That particular foods we have to avoid or restrict it from his diet. Other foods are the alcohol. Alcohol may trigger the inflammatory conditions of the psoriasis. Like that, the nightshades, including the tomatoes, potatoes, peppers, and the eggplant. Like that, gluten, found in the wheat, barley, and the trigger psoriasis in some individuals. It all are the individualized food. Some dairy products may also increases the psoriasis conditions. Uh, so that we, if any patients tell us that, doctor, when we drink milk, it from the next day I see that my skin disease is really aggravated. So we have to advise to the patient that such type of food we have to restrict or avoid as much as you can. Other is the caffeine. Caffeine, the high amount of caffeine may also lead to a inflammation, so that we have to restrict caffeine. And from the homeopathic point of view, that the individual triggers, like what I am before I am telling, that the what triggers psoriasis varies from person to person, so that it's important to identify your own triggers and make adjustment accordingly. That is the best advice given to the patients of the psoriasis. And if we give all the list, patients may have died from this starving. So we cannot advise lots of things. Whether we can advise to the patients that if anything which you consume, or after that you feel trigger that symptoms, then you must have to avoid in these conditions. Apart from this, what food is really neat in a psoriasis conditions? And the first is the anti-inflammatory food. Fatty fish is inflammatory, and the fruits, vegetables, and the heart healthy oils. Second one is the lean proteins like chicken, fish, and beans. But it all are the specific really. If any patient is telling that the doctor, when I took fish, I feel aggravations, then we cannot advise him to eat fish, because in our medicine book it is given that the psoriasis is good for a fish. But when the patients tell that when I took fish, I feel aggravated. So such type of individualized symptoms we must consider, and we have to advise accordingly with this. Otherwise, the nuts and the seeds, rich in a healthy fats and the nutrients, and the fiber-rich food that like vegetables, fruits, and the whole grains. Others is the fruits and the vegetables provide essential nutrients, and these all are the antioxidant. So these all antioxidants are the anti-inflammatory. So we can suggest to our patients to take such type of food in a psoriasis conditions. Uh, what are the homeopathic treatment of psoriasis? We all know that the homeopathy is a holistic system of medicines approaches psoriasis from unique philosophical perspective. Different homeopathic schools or the stalls may have varying interpretations and methodology, but they all are aligned with the core principle of homeopathy as outlined by Samuel Hahnemann. We know that the nowadays are very different school of medicines, and different way of treatment he advised. But what I think that the core principle of the homeopathy is given by the Samuel Hahnemann, and I think all the school must follow this method, or maybe he is following this method, but when he is giving to a presentations, it may be the given or a different path and come to the at the last come to the conclusion with the Hahnemannian homeopathy. So that I advise to my our doctors that Samuel Hahnemann principle is the one of the shortest and the most reliable path which he is given. It is a very effective and very simple, so that it is a very useful for us. And below is an overview of how homeopathy views psoriasis, refreshing its philosophical foundations. Core homeopathic philosophy in the psoriasis. What are the what in about the psoriasis? What are the philosophy says about the psoriasis? That the homeopathic treats psoriasis as a manifestation of an internal imbalance rather than the merely a skin disorder. It is not only a skin disorder, but really it's a manifestation of the internal imbalance of the vital force. And second was according to homeopathic philosophy, skin conditions like psoriasis are often the result of deeper disturbance in a vital force or the body innate energy or the vital force. That is this is the we all read in our organ that the disturbance of the vital force is a main manifestation of the symptoms. Like that, the symptoms on the skin are seen as a outward expressions of an internal disorder. So we cannot what confuse that this is the internal disorder. Really, it's a we cannot confuse with this is outer disorder. Really, it's rather it is an internal disorder. And the core homeopathic philosophy in psoriasis, that is the individualizations. We all know individualizations that the homeopathy emphasizes treating the individual, not the disease. Two people with the psoriasis may receive entirely a different remedies based on their unique symptom, emotional state, and the constitutional makeup. Like that, we also follow a law of similia. The homeopathy operates on a principle of like cures like. A substance that can produce symptoms in a healthy person can cure similar symptoms in a sick person when given in a highly diluted form. And like that, the miasmatic theory that the Hahnemann proposed that chronic diseases like psoriasis are often rooted in a myasm. So, psoriasis is the common associated with the psoric myasm, which is like to itching, dryness, and the un, underlining suppressions of the symptoms. Different homeopathic perspective of the psoriasis. We previously I say that the different school of different school of treatment nowadays treating in a different way. First one is the classical homeopathy, that is the very Hahnemannian method. That is the always focus on the classical homeopaths, strictly adherent to the Hahnemann's principle, emphasizing single remedies and a deep constitutional remedy. What are their approach? That they aim to identify the totality of symptoms like physical, mental, and emotional altogether and prescribe a single remedy that matches the patient's unique presentations. Example of patients with the psoriasis who is anxious, chilly, and has a strong family history of a skin disorder might be prescribed arsenic album or sulfur depending on their specific symptoms. Like if there is the patients with the psoriasis and there is the itching or cracks and the burning. In psoriasis and arsenic and sulfur both having the itching and burning. Uh, but when we individualize the symptoms, that the where the in case of arsenic, cold is aggravated the skin symptoms or a psoriasis symptom, whereas the uh, uh, sulfur is also having the increases the cold symptoms from the cold applications, both having. But once we reverse the application of the warmth, in case of arsenic, when apply a warmth applications, patients feel better. In case of sulfur, when we apply the warmth, it will aggravate. So when we specifically go for the patients of on the basis of individualizing, we must consider these points that individualize the patient. Second was the miasmatic homeopathic. Like this approaches emphasize treating the underlying myelin like psoric, psychotic, or a syphilitic that contributes to psoriasis. What are the approaches? Remedies are selected based on the miasmatic influences and the patient's susceptibility. For psoriasis, the psoriatic myasm, psoriatic myasm is often addressed first, followed by the other layer if necessary. Example, sorinum, a nosode made from the scabious tissue, is often used for psoriatic conditions like psoriasis, especially when there is the intense itching and a history of suppression. Third is the clinical homeopathy. That is the in this condition, the focus are this approaches is more symptoms oriented and may use multiple remedies or a combination remedies. Nowadays, such type of practice is very privileged in our society. And what are their approach? That the practitioners may prescribe remedies based on the most prominent symptom of the psoriasis, such as the scaling, itching, or a burning. For example, graphitis for thick oozing plaques. If the psoriasis is having the characteristic symptom of the thick scales or oozing, like discharge is the thick and the oozing. At that conditions, first of all, coming in our mind is medicine is the graphitis. Like that, Rustux having the itching, red eruption that improves by with worms. Fourth one is the constitutional homeopathy. In this approach, consider the patient's overall constitutions, temperament, and the lifestyle. What are their approach? The remedy is chosen based on the patient's physical and the emotional characteristics, aiming to address the root cause of the disease. For example, a patient with the psoriasis who is irritable, hot, and prone to sorry, it's a chili. A patient is psoriasis who is irritable, chili, and prone to digestive issue might be prescribed Nux vomica. These are the if such type of symptoms comes to the on the basis of constitution, and then the most probable medicine is the comes to the Nux vomica. And common homeopathic medicines for psoriasis. We are very commonly nowadays use repertory like synthesis repertory 8.1. What I always used in my clinic that the synthesis repertory 8.1 radar. That is that if in a skin chapter, if we go in a rubric eruption psoriasis, then we will get total number of medicines is 102 medicines is available in a synthesis repertory. Among them, only four medicine is mentioned in as a bold letter, or we can say that is the first grade of medicines. Like first one is the ars iod, second one is the lyco, third one is the phyto, and fourth one is the sepia. These four medicines are considered as the first grade of medicines and shows in a red color. And among the 102 medicines, only four medicines is the bold letter. Apart from this, the 29 medicines are considered under the italics. That is the second grade of medicines. In 29 medicines, amon mure entim tart, arsenic album, calcarea sulf, cantharis, chinium, acid clematis, fluoric acid, graphitis, iris, and Cali ars, Cali carb, Cali sulf, lobelia, magnum aceticum, merc, mesarium, nitric acid, petroleum phos, sorinum, pulsatilla, rustax, sarsaparilla, silesia, and the sulfur. These are the medicines come under the second grade of medicines, and rest of the medicines has come under the third grade. Okay, so synthesis right in his repertory in this order. If we go through in a Fatek repertory, if we consider under the psoriasis, then we will get 18 medicines in a Fatek repertory. And really, it's a very amazing that the no bold medicine is comes under the psoriasis in Fatak repertory. And the eight among the 18 medicines, only eight medicines are giving under the italics. And medicines are ars iod, clematis, dulca, graphitis, phosphorus, ranunculus bulbosus, sepia, and the sulfur. These eight medicines are considered as italics in a Fatak repertory. If we compare with the synthesis and the Fatak repertory, and then common medicines are we found that ars iod is both present in as a italics in a Fatak as a synthesis. Second was the clematis, both in a italics as a Fatak or a synthesis. Along with that, this graphite is also at the same grade, and phosphorus also the same grade. And in Fatak repertory, CPI is come under the second grade, where in synthesis repertory, no. In a Fatak repertory, CPI is come under the italics and the second grade, whereas the in synthesis repertory, CPI is comes under the first grade, that is in a bold letter. And last medicine is the sulfur, which is in a italics, both in a Fatak and a synthesis. And what are the I found the differentiation in a Fatak as a and in a synthesis repertory that Dulca and the Ranunculus bulbosus. These two medicines are these two medicines, Dul- Dulca and the Ranunculus bulbosus. Whereas the in a in a synthesis repertory there is in a uh, second grade. Oh, no, in a synthesis repertory there is in the third grade, whereas in a Fatak repertory is given in the second grade of medicines. So it is a very unique which I found in both the repertories. And it's a very uh, famous quote by Dr. Sir William Osler. "You don't touch the patient, state first what you see, cultivate your power of observations," which also Henneman says in our organ of medicines. Uh, Before touching the patients, first we have to see as a whole in a patient's what is his nature, his constitutions, his nature of disease, and whatever so is. This is my first case, which I want to show here. That this is the psoriasis conditions. The psoriasis patients come to my clinic. Uh, all over the body, it's a very dry, and you can see all over the body, it develop the psoriasis. and almost he is suffering from last 2 years and taking so many medicines, but he will not get any relief. If so, after that he come to our OPDs, and after seeing this, we get such type of conditions you can see on your mobile or a desk or a laptop. It's a very huge and very dirty looking, like how psychological feeling or emotional is developed in a society. That is a very what I feel. It is a very serious for the patients as a socially, not in a physically, but a very socially. And what I found after case taking, these are the some symptoms which I get from the patient, that the patient having the dry skin, and it is a psoriasis condition which is very scaly, and the itching with thin watery discharge, very mild, not enough, very mild. But when discharged, it aggravate itching. When if he will go in a sun uh, in a sun rays, it will get he will get itching on his skin. Like that, the large scale exfoliations from the eruptions, and such after exfoliation, skin becomes raw and the rage. Cold water aggravation, especially after washing, it causes itching. And father having a tubercular history, and the patients having the recurrent tonsil infection is also present in patients. And when we getting the totalities, we also found that the cold catching tendencies and cervical glands are enlarged in a patient. About the thirst, moderate thirst in a daytime, but at night excessive thirst is present in a patient. And in sweating while lying down at bed, patients having only sweating on only not like aggravate sweating while lying at bed, touching parts of the body has more sweat. These are the totality of the symptom which I get from the patients. And on this basis, uh, I prescribe uh, medicine. First, I will show you that after prescribing the medicines, patient's condition is like this, and he is very happy. And nowadays, he is married. Due to this condition, he is not able to marriage. Now he is very happy. And second one is this. And I would like to say that please, on these totalities, if you find, if you suggest us what medicines I prescribe, if you text me or on a comment box, it is a very helpful for us for a differential diagnosis. And I will say that this I prescribe, I was prescribed to the patient is the ars iode, first patient in a LM potency 0 by 1. uh, and my second case, this is my the second case. This is the psoriasis of the legs, and she is having the 40 years of woman. She developed psoriasis on both legs. I have only one. I took only one picture, uh, and on this basis, I'm not giving here the totality of the symptom. I took in my diaries, but I can share my knowledge here. I can share my totalities here. That she has really come to my clinic after 2 years after developing psoriasis, and he took so many medicines applying steroids to these conditions. And when I was uh, asking the symptoms, and he says it is very itching and now it's a very dry. And when I asked for his past history, now she say that eh, when it developed in initially there is a very much sticky fluid. The fluid is coming out. Fluid is coming out previously before applying ointment or taking some steroid medicines. And I just asked that fluid is also sticky or not, and she confessed that really that fluid is very sticky and smelling. And on that basis, I prescribe a graphitis 0 by 1, and really after taking 2 or 3 months, she will have to very happy. She is very happy, and all the psoriasis eruption is gone from her legs. And now my third case, this is the very chronic case of child, that is the scalp psoriasis. This is the scalp psoriasis developed in 8 years of child, and she took almost 6 months, more than 6 months of antibiotic medicines for her for the scalp psoriasis. Really, if we in this picture, it is not very much clear, but when I was saw this patient, and when I touch her scalp, and the yellow pus is oozing out from her scalp, and very much thick scale is developed on the scalp, and it is mild fever is also there for the patient. And she is only a 8 years of child, and her parents are very much anxious about her, that she tell her parents tell that really, doctor, I she was taking 6 months of antibiotic medicines, but still it is disappear, but again it reappear. It is a very difficult to us. Please go through this. After taking this medicines, this case I will check. I was taking the case taking, and the totality of the symptoms are the pustular eruptions with the mild itching eruption on a scalp lasting for 3 months, and the history of antibiotics 3 episode subside for limited time period, but again eruption reoccurs. And the character of that eruption is the yellow scab on the scalp, discharge yellow with the offensive, grinding teeth during the sleep, habit to eat raw rice most of the time. These are the symptoms, totality of symptoms. Along with that, the generative symptoms are also present, but I not mention here. So on this basis of the totality symptom, I was prescribed medicines, and after taking 2 or 3 months of medicines, she was almost all the pus are dried, and all the wounds are going to recover, and no fever is initiate again. And uh, recent picture is not available in my phone, uh, but after saying in a recent, she is develop all the hair around the scalp and looking very much very beautiful. And it is in these conditions, I was prescribed medicine is the Meserium 0 by 1, and later on I also prescribed Sikuta 200 3 dose. And really, from the bliss of the Hanuman, we will we will able to recover someone suffering. It is a very blessed given by our God and Dr. Hanuman. Homeopathy gives hope for hopeless patients. And thank you, sir.
Good evening, Ravindra. That's an excellent presentation. I had been listening through and through. I'll request Dr. Orko Mukherjee to bring upon our beloved Dr. Debnan Kalyani sir in absence of Dr. Nayak. Dr. Kalyani sir, please share your views and moderate.
Thank you. Thank you, Dr. Bidyut Mukherjee, General Secretary. The most able General Secretary, I can tell you. And many, many thanks to Ravindra for giving fantastic presentation. We are really highly helped. Equally thanks to our inaugurator today, Madam, for coming with us and nicely inaugurating the session. Ravindra has fantastically and step by step has expressed all corners of psoriasis, starting from its nature, type, causation, biochemical activities inside, presentation, homeopathic management, philosophy, diet management, lifestyle management, every aspect he has covered, left nothing untouched. Plus, the fantastic thing is that with his experience, with his collection of knowledge, he has presented his own cases. That is very, very essential for all of us. Repeatedly, I used to tell all of you that the world at this moment wants documentations. So the people that homeopathy can cure. Talk less, so more. So Ravindra has fantastically shown the cases, 3 fantastic cases of psoriasis. Many more cases have been cured by many of us. Request to all of us to come forward and to present those cases because Ravindra has shown 3 cases. May have he has another 13 cases behind that we will be able to see. And if all of us go on presenting our own cases, 2, 3, 2, 3, 4, a time will come when we will see that hundreds and hundreds of psoriasis cases are getting cured. That will confirm our confidence, that will increase our confidence. Not only it will help us, but also it will help the general population, other therapeutic system that yes, homeopathy has got a fantastic scope for psoriasis. See, brothers and sisters, every therapeutic system has got its limitation and scope. Likewise, homeopathy has obviously has got their limitation as you see acute emergency, street accident, some immediate obstructive diseases, like some serious surgical diseases, we are constrained. Homeopathy cannot help much with a very short time. Homeopathy can never produce any artificial sickness, like sedation, like anesthesia, like drowsiness, like hemostasis, like this type of drugs, instant effect to make the patient sick. For better treatment, we are constrained, but we are free. Rather, we are the only system. Unconditionally, we can treat the cases where other therapeutic systems are constrained, like diseases of idiopathic cause, diseases of autoimmune, diseases of inherited diseases. This disease where cause is not known, where whole system is involved, like autoimmune system, how and why reticular endothelial system is being misguided to destroy his own protein, nobody knows. Sometimes it's manifested as arthritis, sometimes it is manifested as heart disease, sometimes it is been manifested by skin disease and many more things. So autoimmune disease numbers are gradually day by day it is increasing in the world, where other systems, they usually provide either conservative treatment or some managements. So long the specific cause is not known to the conventional system of medicine, it is their difficulties, constraints. It might be knowing that recently Government of India for a long period, had different seminars, and in Delhi they decided that homeopathy is very much helpful for mother and child. Skin disease is very much helpful in Unani medicine. Geriatric diseases are very much comfortable, best treated by Ayurvedic system of medicine. Likewise, by combination of different system of medicine, including allopathic system of medicine, they decided Government of India, with help of many doctors from different wings of therapeutic system, that these are the type of diseases should be better preferred to treat by other system of medicine than that of conventional system of medicine. But before decision, since our childhood, many of you might be knowing, those who are a bit older one, that when we started studying homeopathy, skin disease, mother and child disease, and the chronic disease where cause is not known, homeopathy was famous all along. When gynecological system, obstetrics was not that much improved, investigatory system was not that much improved. By virtue of our homeopathic philosophy, we were treating not only pregnant mothers, delivery even complicated deliveries. We were talking about before few seminars that in Calcutta Homeopathy Medical College, the oldest in Asia. If you go there, the front building on the veranda, you will see the L.V. Mitra maternity ward. That is from the very beginning of foundation of the building, more than 100 years. Homeopathy was skilled expert in delivery, pregnancy, pregnant mother. Pratap Chandra Memorial Homeopathic Medical College in Narkelanga, means near Manipala, was founded simply to tackle with pregnant mothers. There was so much rush for delivery and complication of pregnancy. Likewise, homeopathy is all along famous for skin disease because many skin diseases, the root cause is not known. As we have learned today from Dr. Ravindra, that autoimmune disease, nobody knows. We have come to know that it is an autoimmune accident. But why this happens? Nothing is known. Hardly you can tell there are some miasmatic factors, there are some susceptibility, immunity, etc. But exact cause is not known. In these cases, homeopathy is having high hope. Many times I have told, and our literature tells, that homeopathy is an unconditional system of medicine, whether cause is known or unknown, whether pathology is known or unknown, whether disease has ever occurred or not, whether disease is only for the ladies or boys, or of any age, in any place, anywhere in the world, any climate, any ecological factor, homeopathy is free to treat there without any pre-term or preconditions. This is our. So obviously till date, psoriasis is a disease which is being embarrassing disease among all of us. Homeopathy can tackle fantastically. Number of cases we have cured. And it is such an embarrassing disease. Dr. Ravindra has definitely experienced, many of you have experienced that patient becomes sunken, become very much depressed for appearance of the skin. Even family members, friends, they start avoiding touch of the skin out of fear. So a person who is suffering from a disease, being neglected to be touched by other family members even, forget about the relatives and trespassers. Just imagine the condition of his mind. Many times they become so much depressed, they run from one doctor to another doctor. And what happened? Unfortunately, we have learned from Dr. Roy that this psoriasis is an autoimmune disease and of relapsing in nature. What happens usually, what we have experienced, that patient goes to one doctor for the skin disease, he start giving treatment, and most of the doctors will gain the name that he has improved or cured the psoriasis. But after a few months, or after a few months, or 6 months, or 1 year, again the skin disease comes back. When that patient goes to that same doctor, so again the skin has come, he gives treatment, relapse, gain the fame, Again, after 6 months, 1 year, or few months, the complaint relapsed. So doing these things year after year, running from doctor, then what patient realize that this doctor won't be able to cure. Then he goes to another doctor. He takes history. I'm talking about even homeopathy. Of course, in modern system of medicine, they give treatment because psoriasis is curable with or without medicine in every stage because it's a relapsing type of nature. If your medicine is exactly suitable, then only patient will improve. If your medicine is highly wrong, absolutely wrong, then also patient will improve for the timing. So there lies the fallacy. Patients become compelled to run from one doctor to other. That's why there's a specific type of management to the patient of psoriasis. Otherwise, you are bound to miss the case. Not only not being cured, but also being embarrassed. One more information I want to share you that it is our rather proud of NIH OPD that we had in the research department one separate wing of research on psoriasis, obviously clinical and documented research, whose chief investigator was Dr. Bhavesh Samadhi. Many of you might be knowing him, and we are the co-investigator. So more than hundreds and hundreds of cases we have seen. And not only that, without any advertisement, without any rather focusing our improvement, patient used to bring patient in this way. We had few hundreds of cases in psoriasis department, and the research was guided by a famous dermatologist. His name is Professor Dr. Malak. I cannot exactly remember his name. Every week he used to come in the skin department, dermatology, and to consult with the cases. Then Dr. Bhavesh Samadhi to ask how to tackle the cases, what are the cases exactly improving. Because psoriasis was a research project, he had great interest on this research work, and it is his person that yes, homeopathy is quite competent to treat this disease than conventional system of medicine. Oh, just I cannot remember his name, but he opened one skin hospital just behind the bus stand of tank number 13. Sorry, tank number, you are just our OPD gate. Professor. Anyway, many of you might be knowing his name. So we have seen that confidently homeopathy can treat psoriasis, but a technique should be adapted by all of us to guide the patient in perfect way. That is what I am telling. Whenever patient will come to you, first patient will ask, sir, I'm running from one doctor to the other for years. First reply will be, I will tell you, I'll be able to tell you after I listen everything in detail. Before that, I may not be able to tell you perfectly regarding your improvement or cure. Patient may not understand. But you tell the patient, if you find the patient not satisfied, he came to be confirmed that he will be cured. Tell them that unless I do not know what is the reason behind your skin disease, it becomes difficult. That's why I have to listen details of your history. Then to some extent he'll be convinced, start taking case history in details, avoiding particular symptoms to search out individualistic, rare symptom, mentally, physically, to search out what patient he is, of what drug he is, not by name, but by the name of the drug, whether it is CPR or RSAUD or mesoneum, what is the patient? After completion of the case history, evaluate the case to some extent as much as you can before the patient. Then you understand whether the case is curable, controllable, or how far you can go. If you find that even direct questions are confirmatory, that means probably I have told you before, after complete case taking, after evaluation, once you become sure of the drug, then ask some direct mental question to the patient, which patient didn't did not expose or could not tell. If the patient says that, yes, doctor, I have this mentality, I have this physical general complaint, I could not tell you, but I felt that it is quite normal. Say, for example, just after getting from the patient have to run to the closet. Sometimes patient ignores. He tells my bounce is normal, no problem. Likewise, some side symptom, general, passing for a long period, patient may have it. So those type of questions, mentally or physically, asked directly. If patient replies yes, then you are confirmed that your conclusive drugs after evaluation or reparation is 100% correct. Tell the patient, yes, now I can tell you, you'll be cured. Because my instrument is ready and confirmed. Patient has confirmed my instrument, my drug, by direct question. These questions should never be asked before. After your complete reparation, evaluation, then only for just confirmation, you may ask some questions, otherwise you will be misguided. Or we can ask the patient, I'll be able to tell you if we are not very sure of the drug, with confirmation by the patient was not being done to that extent, 100% confirm, we can ask the patient politely, see, to some extent I have come to the conclusion you may be cured, but you have to give a little bit time. Next time when you come after taking this medicine this time, or one or twice, I'll be able to tell you surely how far and to what extent you will be cured. What is my intention? I want to see the Herring's law of cure. I want to see the 12 observation. I want to see what type of second prescription is enlarging. I want to see whether other associate complaints are automatically recovering or improving with psoriasis or not. Maybe so psoriasis is aggravating or as before, but patient is feeling fresh than before, having good sleep, appetite has improved. He is looking fresher than before. We are confirmed our medicines correct. Our philosophy has taught us that avoiding particular symptoms, if patient as a general improves, become sure that your drug is confirmed. Then the first, second time or third time, confirm the patient, yes, he will be cured by me. But you should not forget to tell him, he will be cured, but not at a glance. This disease nature is intermittent in time. Automatically, with or without my medicine, you will feel improvement, but do not be encouraged or hopeful for that improvement. I will tell you what are the improvements are coming before you, and yourself and myself will be confirmed. What are those? As I was stating, some other general symptom will start improving for which patient was suffering, like patient is gaining normal body weight gradually, patient is having normal sleep, normal appetite, feeling fresh like anything, has become more energetic. These are the indication your drug is right. Now you can tell the patient that in spite of this relapse, which is the normal natural tendency of the disease, you have to wait, you have to give it time until your affected area become normal skin color and structure. And that will happen. How? The later part, where eruption comes in the latter part, will first get improvement, and those areas gradually become normal skin color and structure. By this way, in the reverse order of their appearances, things will go off. And once they go off, it will go off for you forever. Never will experience any relapse. Then only patient will be confident and he will provide you time. He will be very sure that yes, there will be relapse. I have to wait. I have to report exactly in time, doctor says. Not only that, not only my psoriasis is improving, but my mental situation, I was depressed. I could not go to the to the public functions, but now I can go. I feel proud. I don't care my disease. This type of God's mental strength I got again. Maybe so I wanted to suicide for my skin disease, especially for the women I am treating. They are very shaky, very sensitive regarding their skin. Sometimes this type of melancholia develops that better die than to live in this situation. Patient will tell you that that mentality has completely off. Now I will live. I will survive with the disease. I don't care my disease. These type of improvements are exactly improvements of treatment. And I was telling that hundreds and hundred cases. I don't have the documents at the moment. I have few later on. I will show you once I get chance. Number of cases under a famous dermatologist, probably Dr. Malakar, so far I can remember his name. Anyway, many of you might have seen him, that psoriasis is completely curable. Not only that, as I frequently tell you, with the psoriasis, because it's a systemic disease, autoimmune disease, not a skin disease, not only it gets cured, but it cures many, many disorders, diseases of the skin automatically by virtue of a single drug. So this disease is a highly constrained disease for the therapeutic system, those who trigger some causations, because it has got no causation. And nobody knows why autoimmune system react like this, destroy one protein or fight some protein with other protein. One more thing I want to tell you, that I have experienced one drug. What I found, that most of the time patient become depressed and come to the doctor, but there are patients who will feel so much sicky that they will try to avoid their family members. They are staying in some other room. Their dresses are being cleaned outside. Doctors advise this is not a contagious disease, but they cannot bear family members ignoring. They are so sensitive, want to get cured so quickly, they bow down their heads like anything. Continuously, they will go on disturbing, and disturbing. Means, doctor, please save me. It is better to die. Please help me. I cannot live with this. I cannot go to the office. I cannot go to any function, public function. The things are so embarrassing. So if you find such type of patient who are so much embarrassed, highly depressed, and complaining for skin disease, never think or never forget of Staphyseria. Our teacher used to teach Staphyseria, telling a single word, that is Ghan patient in Bengali called as. You might be following. Ghan means always complaining, nagging, complaining, and disturbing. Once he will come in your chamber, he will make you embarrassed and angry like anything by complaining the same words. He'll repeat and repeat it. Because of the reason he is feeling highly depressed of his own respect. This over sentimental mentality, over prestigious mentality is being disturbed by the skin disease. That is why disturbing to get rid of his complaints. Never forget to think about Staphyseria once if you do not get other clear indication, as it was expressed by Dr. Roy. Moreover, the skin nature, many times, it looks like exactly Staphyseria skin as it has been mentioned in the literature. So, Nectrum salve, this Staphyseria is a drug which is not mentioned in the repertory. That's why I'm telling. Nectrum salve, other consular drug, starting from the AB scan to gingham. Any drug might come for psoriasis. Observation, mental symptom, physical symptoms are very, very important. Many times I have told you what my teachers has to teach us, that once you are seeing the patient, do not see his complaints more, see his face, his appearance, his mode of talking, his mentality, and try to concentrate your mind on his mind more, because mind becomes sick first by miasms, then manifestation comes later, physical symptom. As last seminar I was telling regarding the effect of regarding the benefit of mental symptom, I want to remind you, I forgot on that day, but I'm not able to restrain myself to tell that indication of Professor A.C. Day. Last when I was telling, his retinal detachment, bleeding from the retina, almost you are going to be blind. When you ask for our help, he was a very strong personality, and he's telling very slowly, "Can you help, Dr. Kolkata? This is my situation. I'm going to be blind. My brains are normal, my hearts are normal, but my eyes are gradually dying." And my consultant, my students, other doctors have still, it is very difficult to improve. It is not being controlled. So I do not know what will happen within a few months. Then I told you that I gave him Nasmika. Depending on the symptom, he is having conquering attitude. I have forgot to tell you on that day, one conquering attitude mentality he had is very, very striking. All of us should never forget the symptom. One day, while he was suffering from respiratory distress, frequently used to suffer, and I used to give him gaseous software infrequently, lower potencies. He gets temporary relief, but he used to carry always puff. One day I told him, Sir, may I request you one thing? He said, yes, I know what you want to tell me. He was under this that taking puff. I know what you want to tell. I remember, Mom, he told, you are advising me to stop smoking. I became mum. Just realize his feelings. He is telling Dr. Kalyani, I thought it, I know much more than you. But I decided, when death is a must, let us have a courageous death. Why to leave cigarette? I will go with more smoking. This is conquering attitude. Never to go down, even to death. That's why our little Lakshmika 6 gives fantastic improvement to such a fantastic person. So this type of mentality, if you want, fine. Of any disease, that patient is ready to die, patient is ready to be tortured, like those who are drunkards, habitual drunkards. You see, they're ready to die. They know that I may have cirrhosis of liver, but they cannot live because decided it is better to die, not to withdraw with alcohols. If we find such type of mentality in any disease, take it for granted, this is conquering attitude. Never bow down to anything, even to death, by changing his lifestyle. Step 2, a great mental symptom. If you find those symptoms very sensitive, single little insult cannot bear. Days together he brood on and puckering, cannot forget that insult. It is staphysagria. Moreover, there are some drug inclination in area basis, as you have been taught by Dr. Rai. So this area, because it is highly humid area, many times in our OPD also you have seen that natrum salt, because of the high humid area, hydrogenate atmosphere of this Bengal, Bangladesh, this natrum group of drugs, natrum mu, natrum salt, natrum ars, comes up much more use. But whatever, but never remember that these drugs are the drugs for psoriasis. Any drug may come. Our attitude of connection of symptoms, I am telling, must be very, very keen, very sharp, more on mental symptom, mental general, on physical general. Because psoriasis is a one-sided disease. Cause is not known. Obviously miasmatic. May or may not be inherited, but very difficult to cure. But homeopathy can cure. We have seen hundreds and hundreds of cases. Unfortunately, at that time, we did not have any documentary center. Probably is still not there. But over mobiles, Dr. Samanto ourselves collected many cases with fantastic improvement. The proof is I was telling that we did not have any board for psoriasis. No that much famous research department, very small. But by getting cure, patients are bringing patients. On one day, probably that's on Monday, Tuesday, Wednesday. Every Wednesday, respected dermatology used to see only psoriasis cases with Dr. Samanto in OPD. Such a number of cases we had. So, along with all other skin diseases, psoriasis is a constrained disease, but homeopathy has no constraint with this type of disease. Not only that, if you can cure one psoriasis cases by properly guiding the patient, that patient will bring patient throughout your life. To anyone, his relative, friend, those who are insulting or avoiding or neglecting, they will come to know how did you got cured. Then he will boldly refer them to you. You go to that doctor by train or whatever may be distances. He will tell you whether he will be able to cure you, and you will get cured if he says it is curable. So one psoriasis patient cured means you are expected to get number of various cases in your near future. As hundreds of fever, thousands of diarrhea if you cure, those patients may not send patients. Your clinic may not be that much improved. But if you can case this, if you can cure this type of constrained, one-sided, difficult cases, be sure that one case cured means you are expecting 100 cases within a very short period. So with all this, thank you very much. Those are viewing and those will be viewing later on. And many thanks to all of you. Requesting again to come forward with your experiences. Everyone, you are having experiences to focus with us, to present with us, to enrich our knowledge, to improve confidence. Thank you very much.
Online. Good evening, sir. Thank you so much, Dr. Ravindra. And I'm really overwhelmed to see that we have with us almost 85 live viewers in YouTube and another uh, few hundreds. I had been writing in the chat, almost 500 live viewers in the Facebook. So our message to the homeopathic fraternity is being strongly being reached, I presume. And we thank all the people across the globe who are supporting us. We are very lucky to have with us our beloved director in charge, Dr. Pralay Sharma, who had been blessing us and gracing the occasion since he had taken over the charge. Before that, also, he has been there. And today we have our two brothers and sisters from Nepal. Uh, as Sir had said, and appealed to all the alumni across the globe, be there as a speaker, be there as a content creator. The topic is yours. We'll be telecasting them, but please reach us on time. And for all the alumni, please be a full-time member. Please come forward to strengthen the alumni. There has been a call from the Alumni Association, been seconded by the Director in charge, Dr. Pralay Sharma. On 10th of December 2025, let us come together at NIH with a huge number. We are almost over 2,500 alumni across the globe. In Nepal, in Bangladesh, in Sri Lanka, in Germany, in Russia, we have one, two, and in other European Union states, apart from our beloved India. So please mark the date 10th of December. The details, eternity will be announced on discussion with the NIH authorities and the Ministry of Ayush in a very short while, most probably within April. And all the people who are watching and will be watching in the coming days, please mark the date 10th of December to commemorate the 50th anniversary celebration, the closing day of foundation of NIH. We will be meeting at NIH and the program details will be shared in due course of time. But please mark your dates. 2,500 alumni across the globe be at NIH. Come to your alma mater, and we all will be sharing and meeting each other on that day. I think, sir, you had been there on the felicitation day of our new director in charge, and our beloved director in charge had made certain statements. We hope those things will be followed up by our association, and under your guidance, your blessings, we will be following it up in due course of time. And apart from that, our next program in NIH, jointly with the authorities of NIH, it will be jointly with the authorities of NIH, We will be meeting physically at NIH on the birthday of our master Hanuman, that is 10th of April. So those of you who are planning to make a visit at NIH, please mark the date. Next, we'll be physically meeting on 10th of April, but before that, our 114th CME will be on 9th of April. With that, with the permission of our beloved President, I'll return to our backstage editor, Dr. Orko Mukherjee. Thank you, Dr. Ravindra. Thank you, Dr. Geeta.
Thank you and good night to all of you. Many thanks. Please
Thank
come
Good
again.
night. Sir.
Thank you. Good night, sir.
Good night.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. And one more thing is that uh, many will be having the doubts of getting e-participation certificate. Today's e-participation certificate. For now, let me just clear this out that we are currently keeping it on hold as we are facing some technicality issue with the Google Drive, and after that, means after clearing that issues, we will be coming back again with with the e-participation certificate thing. And so, with this, thank you again. Thanks for watching. If you have liked this, please do make sure to give it a like, share with your fellow mates, and also do not forget to subscribe. Click on the red subscribe button, and then click on the all notification button so as to get updates as soon as we start a live stream or schedule a live stream. And also don't forget to join our WhatsApp channel. The link is in the description. Just check on that. We always give updates over there too. So don't forget to join our WhatsApp channel. And again, thanks for watching. And those people who are watching on Facebook, please share to other groups and other your fellow mates and other fellow mates so that they can also watch, and also share it on your timeline so that many get notified about this. So with this, again, thanks to one and all watching. See you in our on our next CME. Until then, good night.